Hi everyone and welcome to another video from Crack the Boards. Today we'll be tackling some high-yield cardiovascular questions. So let's start with the first question. A 45-year-old man arrives at the emergency department with sudden onset chest pain that started at rest and radiates to his jaw and left shoulder. He has no prior history of heart disease. On examination, his heart sounds are normal with no murmurs or pericardial rubs. He is given oxygen, aspirin, and sublingual nitroglycerin, which relieves his symptoms. Serial cardiac enzyme tests remain within normal limits. His initial electrocardiogram shows ST elevation in leads V3 to V5, but subsequent electrocardiograms are unremarkable. Which medication would be most effective in preventing recurrent episodes? Now, this question is a classic presentation of variant angina, which is also known as Prinzmetal angina. It occurs due to coronary artery vasospasm, which leads to temporary myocardial ischemia and ST elevation. Unlike typical angina, which results from atherosclerosis and is associated with exertion, variant angina occurs at rest and is caused by transient vasospasm rather than permanent obstruction. The options given here are A. Aspirin, B. Diltiazem, C. Metoprolol, D. Propranolol, E. Simvastatin. Now the correct option here would be B. Diltiazem, which is a calcium channel blocker, and it is the best option for long-term prevention of variant angina. Calcium channel blockers, they work by relaxing the vascular smooth muscle and prevent vasospasm. This class of drugs is the first-line treatment for preventing recurrent episodes. Let's have a look at why the other options are incorrect. Option A, aspirin, is incorrect because aspirin can actually worsen vasospasms by inhibiting prostacyclin production, which is a vasodilator. Therefore, this is not the best choice for preventing further episodes in this patient. Option C, metoprolol, is incorrect because metoprolol is a selective beta blocker used to manage hypertension and ischemic heart disease. And beta blockers are not effective for variant angina because they do not address the underlying issue of the vasospasm. Option D, propranolol, is incorrect because propranolol is a non-selective beta blocker and is usually contraindicated in variant angina. This is because it can lead to excessive vasoconstriction and provoke more vasospastic episodes. Option E, simvastatin, is incorrect because simvastatin is actually a lipid-lowering agent and it has no role in preventing the vasospasms seen in variant angina. A 47-year-old woman visits her physician for routine checkup but forgets to mention her history of asthma and that she has been taking medications for it and is well controlled. She is diagnosed with mild hypertension and prescribed an antihypertensive medication. 1 week later, she presents to the emergency department with worsening shortness of breath, wheezing, and a persistent cough that has progressively intensified over the past 2 days. Which antihypertensive medication is most likely responsible for this patient's symptoms? Now, the symptoms mentioned here are strongly suggestive of asthma exacerbation, and the most likely culprit is the new antihypertensive medication. To answer this question, we need to consider the medication's mechanism of action and its potential side effects. The options provided here are A. Prazosin, B. Metaldopa, C. Captopril, D. Hydrochlorothiazide, E. propranolol. The correct option here would be E, propranolol. Now, propranolol is a non-selective beta blocker, meaning it blocks both beta 1 and beta 2 receptors. By blocking beta 2 receptors, it prevents bronchodilation and can cause bronchoconstriction, leading to asthma exacerbation. Let's have a look at why the other options are incorrect. Option A, prazosin, is incorrect because prazosin is an alpha-1 adrenergic receptor antagonist that lowers blood pressure by causing vasodilation. Since prazosin does not affect beta receptors, it does not cause bronchospasm. Option B, methyl-dopa, is incorrect because methyl-dopa is an alpha-2 adrenergic agonist that works to reduce sympathetic outflow, lowering blood pressure. This drug does not have any significant impact on beta 2 receptors or cause bronchoconstriction. Option C, captopril, is incorrect because captopril is an angiotensin converting enzyme inhibitor that lowers blood pressure by preventing the conversion of angiotensin 1 to angiotensin 2, leading to vasodilation and reduced aldosterone secretion. Angiotensin converting enzyme inhibitors can cause a chronic dry cough due to the accumulation of bradykinin in the lungs, but they do not directly worsen bronchoconstriction in asthma patients. Option D, hydrochlorothiazide, is incorrect because hydrochlorothiazide is a thiazide diuretic that lowers blood pressure by increasing the excretion of sodium and water in the kidneys. They do not have any significant effect on the airways.